Pregnancy is supposed to feel like a happy time, maybe the happiest. And so when it doesn't, when what you feel instead is dread or flatness or a heart that won't stop racing or a mind that won't stop running worst case scenarios at 2 a.m., many women don't say anything. Because how do you say that out loud when everyone is congratulating you and expecting you to enjoy every moment? You may be lying awake catastrophizing about every possible thing that could go wrong with the baby, with the birth, with your relationships, with your ability to handle what's coming. You may have even started having panic attacks, heart pounding, chest tight, barely able to breathe, that come out of nowhere and leave you feeling terrified. You may feel a constant low level dread that something terrible is about to happen, even when everything looks fine on paper. And you maybe even have mentioned it to someone and been told that some worry is normal in pregnancy and just to try to relax. Now, some worry is normal, but anxiety that is disrupting your sleep, affecting your relationships, and taking over your daily life is usually not just pregnancy jitters. It could be a clinical condition and it deserves real treatment, not reassurance or dismissal. Today, we're talking about anxiety and panic during pregnancy, what the difference is between normal worry and a perinatal anxiety disorder, why it's so often dismissed, what the risks are of leaving it untreated, and what actually works, including medications, what supplements are low risk to use during pregnancy, and which ones to avoid. I'm Dr. Susan Zink. I'm a board certified adult psychiatrist with special expertise in women's mental health and reproductive psychiatry. Anxiety during pregnancy can look different from what most people picture. It's not always lying awake worrying, although it can be that. It shows up in a lot of ways that women often don't connect to anxiety at all. So, what are some of the ways anxiety can show up? A persistent, uncontrollable worry that you can't redirect, especially about the baby's health, the birth or delivery, or your ability to cope. Sometimes it's a racing mind at night that won't let you sleep even when you're exhausted. Or it's irritability and a shortened fuse, snapping at people you love over small things. Sometimes anxiety shows up as difficulty concentrating or making decisions, and often there are physical symptoms. These are really common: a racing heart, chest tightness, shortness of breath, headaches, muscle tension, nausea, and that persistent sense of dread or fluttering, kind of like butterflies in your chest or stomach. Panic attacks are very common. These are sudden, intense surges of physical symptoms that can mimic a heart attack and usually resolve within minutes, but leave you feeling really frightened and avoidant. Health anxiety can come up. It can look like an obsessive worry about whether something is wrong with the baby or wrong with you. Maybe you're seeking reassurance repeatedly Googling symptoms. And intrusive thoughts are more common than anyone talks about. These unwanted, disturbing, repetitive mental images or fears you would never act on, but you can't stop thinking about. I covered this in depth in the perinatal OCD episode, so check that one out. High functioning anxiety is also worth naming here because many pregnant women appear composed and capable on the outside while privately managing a constant hum of fear, tension, and catastrophic thinking that nobody around them can see. Perinatal anxiety, which is anxiety during pregnancy and the postpartum period, affects a significant percentage of women, and it is still frequently overlooked or attributed to normal new parent stress. If these symptoms are disrupting your functioning, interfering with your sleep, or making pregnancy feel like something to survive rather than experience, that's worth taking seriously. There are a lot of reasons anxiety during pregnancy gets missed or minimized. First, some worry during pregnancy is genuinely normal, which makes it easy for well-meaning people and even clinicians to hear a woman's concerns and file it under typical. The threshold question, how much and how impairing the worry has to be, doesn't always get asked or evaluated. Second, perinatal mental health screening has historically focused on depression more than anxiety. The Edinburgh Postnatal Depression Scale, which is the most commonly used screening tool, does include some anxiety items, but anxiety disorders can still fall through the cracks if someone isn't looking for it specifically. Third, many of the physical symptoms of anxiety, like the racing heart, the shortness of breath, nausea, fatigue, overlap with normal pregnancy symptoms. This makes it easy to attribute the whole picture to the pregnancy rather than looking at whether anxiety is driving some of it. So, why does identifying anxiety and talking about treatments matter during pregnancy? Untreated anxiety during pregnancy is not only a quality of life issue, it carries meaningful risks for both the mother and the baby that are worth understanding because understanding them is part of what makes the case for treatment. Chronic, unmanaged anxiety activates the body's stress response and keeps cortisol, the primary stress hormone, a little too elevated over time. That elevated cortisol during pregnancy has been associated with increased risk of preterm birth, low birth weight, and disruptions in fetal neurodevelopment. Untreated anxiety also affects sleep, nutrition, prenatal care management, and the capacity to bond with the baby after delivery. This is the reframe that matters most. Untreated anxiety is an exposure to a developing baby. Most people think really carefully about what medications they take during pregnancy because they're aware that those medications are potential exposures that the developing baby experiences. But what is less intuitive, but equally supported by research, is that sustained, unmanaged anxiety is also an exposure. The goal of treatment is not to avoid intervention at all costs, it is to minimize the number of harmful exposures overall. And often the risks of untreated anxiety outweigh the risks of treating it. Now, this isn't meant to scare you. It would be great if you didn't have an anxiety disorder at all, but if you do have an anxiety disorder, it's important to understand that treating it can have a lot of benefits to both you and your baby. What treatment options are available? First, let's talk about psychotherapy. For mild to moderate anxiety during pregnancy, psychotherapy is a first line treatment and the evidence behind it is strong. Specifically, cognitive behavioral therapy or CBT is particularly well suited and well studied for anxiety. It works by identifying thought patterns and avoidance behaviors that sustain anxiety and then it systematically addresses them. It doesn't require medications, it has durable effects, and it can even be done virtually. Then there's interpersonal psychotherapy or IPT, which is another evidence based option that focuses on relationships and role transitions. And the transition to parenthood or motherhood is among the most significant role transition a person goes through. Many women find it particularly useful during the perinatal period. For anxiety that is disrupting sleep, cognitive behavioral therapy for insomnia or CBTI is a targeted medication free approach with strong evidence, and it is also safe and appropriate during pregnancy. So, what about medication? For moderate to severe anxiety during pregnancy, medication may be appropriate. And this is a conversation that deserves real depth, not a dismissive order to just power through it until after the baby is born. SSRIs, the same class of antidepressants used for depression, are also first line for anxiety disorders. Sertraline, escitalopram, and fluoxetine are among the most commonly used and best studied options in pregnancy. The data on these medications in pregnancy are substantial. Studies have not demonstrated an increased risk of major birth defects in children exposed to SSRIs in utero, and perinatal psychiatrists consider them generally compatible with pregnancy when clinically indicated. The decision to use medication during pregnancy is always made through a careful collaborative conversation about the risks and benefits of both treating and not treating. There's no one right answer, but for a woman with moderate to severe anxiety whose quality of life is significantly impaired, whose sleep is non-existent, and who is struggling to engage with prenatal care, that's not a situation where watchful waiting is obviously the safer choice. Even more than that, untreated anxiety can carry risks to the baby, like I talked about before, higher risk of preterm birth, low birth weight, and longer-term neurodevelopmental problems in children. If you're already on a medication for anxiety or depression and you become pregnant, talk to your doctor first before you make any decisions about stopping or continuing your medication. Abrupt discontinuation carries its own risks, and a plan for how to manage medication through pregnancy should always be made in collaboration with a knowledgeable clinician. In later videos, I'm going to talk much more in depth about taking medication during pregnancy, the conversation about this, how I approach it, and what the risks and benefits are. One of the most common questions I get from pregnant women is, what can I actually take for anxiety that's safe? So let me walk you through what the evidence supports for anxiety during pregnancy and, importantly, what to avoid. A lot of women want to know about natural supplements and other integrative options other than therapy and medication. So first of all, nothing is completely safe in pregnancy or even in life in general. There's almost nothing that carries zero risk. So I always talk about this in terms of risks and benefit and which medications and supplements are lower risk and have more reassuring safety data. And just because something is a supplement or natural doesn't mean it's safe or even low risk. So first, let's talk about magnesium. Magnesium glycinate is one of the most useful and safest options for anxiety during pregnancy. It works in a lot of different ways, probably by increasing GABA availability in the brain. And this is the same calming neurotransmitter system that anti-anxiety medications target. It may also reduce NMDA receptor activity, and it may be involved in neurotransmitter metabolism. The glycinate form crosses the blood-brain barrier more effectively than other forms. It also supports sleep, can help with headaches, muscle tension, and can be beneficial for restless leg syndrome, which increases significantly during pregnancy, as we'll come back to. If constipation is a concern, magnesium citrate or oxide has a laxative effect and can serve double duty. There's another supplement called lemon balm, which has a lot of reassuring safety data too. It's another option with reasonable evidence for anxiety and sleep. It's in the mint family. It's generally well tolerated and has the additional benefit of helping with gastrointestinal symptoms like nausea, bloating, and digestive discomfort. And it can make it particularly useful during pregnancy when those complaints are common. Now, what should you definitely avoid during pregnancy? There are several popular anxiety supplements that should not be used during pregnancy, and it's worth being explicit about this because they're widely available and commonly used outside of pregnancy. So first, oral lavender, which is also often called Silexin or Calmade, is a brand name, is not recommended in pregnancy or while breastfeeding due to its effects on estrogen. L-theanine just doesn't have enough safety data in pregnancy, so it's best to avoid this until the data are clearer. Ashwagandha is an adaptogen that has been around for a while, but it's not recommended during pregnancy due to its potential effects on the uterus. And then there's chasteberry, which is also not compatible with pregnancy due to its effects on reproductive hormones. The general principle is this: when in doubt about a supplement during pregnancy, ask your doctor before starting it. Not everything labeled natural has safety data in pregnancy, and natural does not automatically mean safe in this context or in general. Let's talk a little bit about restless leg syndrome. And here's a note on restless leg syndrome. This is worth its own mention because it's common, it's frequently missed, and it can cause significant sleep disruption that amplifies anxiety. Restless leg syndrome, which is that uncomfortable urge to move the legs at night, often with a tingling or kind of a creepy crawly sensation, increases during pregnancy, and it's often driven by low ferritin, the body's iron store. So if you're experiencing this, you may want to check your ferritin levels, specifically not just the hemoglobin or a general iron panel, but ferritin itself, which is a measure of iron stores in the blood. Repleting or replacing iron when it's low can resolve restless leg symptoms and significantly improve sleep, which in turn helps anxiety. Magnesium also can support restless leg syndrome too. Let's talk about some lifestyle and other integrative practices. Gentle daily movement like walking, prenatal yoga, swimming can all be beneficial for anxiety during pregnancy and has good safety evidence. Prenatal yoga specifically has been shown to reduce anxiety and support sleep. Morning light exposure supports circadian rhythm and mood. Social connection is a meaningful protective factor. These are not small additions, they are real contributors to nervous system regulation. If you recognized yourself in any of what I described, the most important thing you can do is say it out loud to someone who can help. That might be your OB, your partner, your primary care doctor, a therapist, or a reproductive psychiatrist. You don't have to wait until after the baby is born to get support. In fact, getting support during pregnancy is one of the most protective things you can do for yourself and for your baby. Next week, I am talking about what to expect at your first psychiatric appointment, what the evaluation actually looks like, what questions to expect, and how to get the most out of that first visit. If you've been thinking about reaching out for care and aren't sure what to expect, that one is for you. Subscribe so you don't miss it. Leave a comment below if this was helpful or if there's something you wish I'd covered. I'll see you next week.